All right, quick question. Have you ever seated a crown and thought, why does this feel harder than it should? If you want better crown results in 2026 that require less adjusting, fewer remakes, and way less frustration, you're in the right place. As you can see in the title, this is about dentists versus dental lab and getting back to the basics. No, this is not a video where the dental tech finally gets revenge on the doctor, but this is going to be for the benefit of the doctor. I've been a dental tech for 12 years, and from behind the scenes, we see the same issues over and over again. It usually comes down to just a few basic mishaps. Things like how the tooth is prepped, how impressions or scans are taken, and how clearly things are communicated to the lab. When those are dialed in, crowns tend to fit better, look better, and everyone wins, especially your schedule and your stress level. And who doesn't want less stress? But honestly, it also makes the doctor and lab relationship way more profitable and a lot less painful. So stick with me till the end. Go ahead and grab yourself a cup of coffee because I'm going to break these fundamentals down into practical tips you can start using right away to get better results in 2026. So when crowns get frustrating, it might not always be because someone is doing something wrong. Sometimes it's just little gaps in the process, and those gaps start to add up. Once we can clean them up, crowns stop feeling like such a grind. I think we can all agree that the doctor and the lab alike both want a few simple things: less adjusting, fewer remakes, and way fewer why is this happening moments. Let's walk through some of the main things that I believe make a difference. We're going to start with the big one. We're just going to go ahead and rip the band-aid off, and that is tooth preparation. Probably the number one issue labs see is not enough reduction. And I get it, everyone wants to be conservative, but most crown materials need about 1.5 to 2 millimeters of space to work properly. When that space isn't there, we only have two choices: make the crown thin and risky, or bulky and ugly. So when you give the lab enough room, everything gets much easier. The anatomy looks more natural, occlusion is more predictable, contacts aren't a constant fight, and even seating the crown feels smoother. And honestly, the crown just behaves better long term for the patient. I find that a good rule of thumb is if you're questioning whether there's enough reduction, there probably isn't. And a little extra time during prepping saves way more time during delivery. Another thing we see in the lab is tissue management being an issue. It's one of those things that doesn't feel very exciting, but it's huge for making sure you receive a crown that will actually match the margins you trimmed. And if the margin isn't clear, the lab is guessing. And the consequence of guessing almost always shows up at the seating appointment, and it's never good. I suggest going back to your basic double cord technique around your margins. Double cord really is your best friend here. Small cord first, bigger cord on top. You're not trying to traumatize the tissue, just gently move it out of the way. When the top cord comes out and the margin is clean and visible, scans and impressions just work better. And this helps with everything: the fit, margins, contacts. It's one of those steps where slowing down for a minute actually speeds up the whole case. So here's another question: are you doing digital impressions or you're still doing traditional impressions? Whether you've gone fully digital or still doing traditional, the basics matter more than the method. For scans, moisture control is everything. Saliva, blood, and even fog on the scanner tip can mess things up. A clean, dry field gives the lab crisp margins and fewer questions. And following the same scan path every time really helps with consistency. If you're taking impressions still, same deal. Dry field, good retraction, and let the material set up. Pulling that impression early is one of the fastest ways to ruin it. And tray selection matters also. A rigid metal or hard plastic tray reduces that flex, which means better accuracy and less distortion. And if you're already scanning for that digital impression or making a traditional impression, go ahead and give a second one that is of the pre-op. Having that as a reference to what the patient looked like before prepping, it allows us as a designer and the contour techs to create a smile for the patient that looks natural. Having no frame of reference can lead to unhappy patients because unfortunately, teeth are not one size fits all. And another very common mishap in the lab are bites. Bites cause more problems than they should. Labs say that almost 90% of bite records aren't accurate. And yes, I'm in that 90%. But that's not always the doctor or the assistant's fault. But we can help improve those bites. Most patients are numb. You stuck them with the needle, they can't feel anything, they don't know where their bite is. So just saying bite down might not be enough. I just suggest guide them, make sure they're fully seated down when they're biting, and then inspect the bite before it leaves the room. The goal here is real simple. Give the lab something they don't have to second guess. So clear instructions help a lot. Telling the patient to hold still, not to chew, not to open and close while it sets. Those little things can save you a ton of occlusal adjustment later on. Another major thing is communication with the lab. This is where cases really succeed or fail. Most lab issues don't come from bad work. They come from missing information. The prescription is so important, and if it's missing information like the material, the shade, the stump shade, or the return date, all of those things will slows everything down. And when the lab has to guess, that's when results get unpredictable. Also, try not to give mixed signals. Asking for high aesthetics with minimal reduction or choosing a material that doesn't match the prep puts the lab in a really tough spot. If you're unsure, just call them. Seriously, a 2-minute conversation up front can prevent a world of remakes in the end. Most labs have customer service reps standing by to answer your calls and help you with anything they can. Our lab has 4 floors, and each floor has their own designated CSR team, plus an additional CSR rep for each department. And just because we value our doctors, we can connect you directly to our supervisors to really dive deep into a case. And I can't not mention feedback. Feedback is so important. It goes both ways as well. If a crown was great, tell them why. If something needed adjusting, explain what you changed. Labs remember that and use it on future cases. For our lab, all call notes are stored in your customer account in our system along with doctor preferences that you prefer to have done for every case that enters the lab. The lab wants to help you make the right decisions for your patient. No doctor wants to disappoint a patient at seating because they made the wrong material choice, the wrong shade match, or didn't give enough information on the RX. We all want satisfied customers who are proud of their new smile because good reputation plus good customer retention equals good growth. And another form of communication is photography. If you're not using high quality photos from a DSLR camera or a smartphone with good lighting, you're really doing yourself a disservice. Photography is one of the easiest wins out there right now. Words don't describe teeth very well. Photos do. A single shade tab number doesn't show translucency, texture, gloss, stains, or how the tooth looks in different lighting. Good photos let the lab see exactly what you're seeing. I also suggest to always take photos before prepping the teeth. Teeth dry out quickly, and when they do, they change colors. So having that original photo with the original tooth color really helps, especially when you include multiple shade tabs in the photo. I also suggest sending more than one photo. Photos like a full smile, retracted view, close-ups with the shade tabs, incisal shots, and pictures of the neighboring teeth. All of these photos help us with the final product. And when it comes to lighting, natural is good, but always remember, ambient is better. And don't be afraid to use a little short note saying things like the patient wants softer texture or focus on the incisal translucency. When we see those things in the photo and you make a mention of those things, we can make those adjustments and make sure it's in the final product. And I'll go ahead and include a bonus for myself. Before and after photos, they're so important because as lab techs, we're encouraged by knowing that we are changing lives. Seeing the real fruits of our hard work makes what we do so much more personal and exciting. We always say, treat every case like it's your mom's case. And you're going to do a good job on your mom's case. Nobody's trying to upset mama. So sending those before and after photos helps us see every case as a personal case, and it turns people from robots into dental technicians. And our last major point on what you can do for 2026 is technology. Because digital dentistry isn't optional anymore. It's just how things are moving. Labs are using powerful softwares like EXOCAD and Blender for Dental, which means designs are more precise than ever. Also, utilizing features like the web link in EXOCAD allows the doctor like you to see a 3D visual via an internet link to be able to interact with the scans and designs yourself before approval. There's also the Smile Creator, which allows a designer to place the design inside the mouth of the patient using a 2D image so that the doctor and patient consultation is easier and way more efficient. Not all labs have this tech, but we do. But all that depends on good digital input. Using an intraoral scanner consistently, training your team, and sticking to a digital workflow makes everything more predictable. Some offices are even doing in-house 3D printing for models and temps. It's not required, but it's definitely becoming more common. But having a lab that already uses 3D printing is going to save you a lot of money. Traditional impressions cost more than most people think. Materials, labor, shipping, remakes. And if something happens to the model while it's in production, we're going to have to start over. Digital scans don't have that problem. Models can be reprinted at any time. Technology doesn't replace skill, it just makes good dentistry easier to deliver consistently. In this new age, people want fast, accurate, and reliable results. So I say, embrace technology. It's a good thing. At the end of the day, better crowns don't come from working harder. They come from tightening up the basics, communicating clearly, and using the tools we already have just a little better. When doctors and labs are actually on the same page, crowns stop being so stressful and start being predictable. Well, I hope you enjoyed that video. I hope there's something there that you can take and apply it to your clinic so that 2026 is the most successful year you've had so far. Because again, the relationship between the doctor and the lab is so important. It's not just the doctor over here and the lab over there, it's a partnership. And when you see it as a partnership and a relationship, there's no reason to not have success. And hey, do me a favor, go easy on your dental lab. Those dental techs are in there working hard. I'll see you next time.